for quality, affordable health care. Thank you, and I yield back.
Gentlewoman yields back. Gentlewoman from California, Ms. Speier, is now recognized for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I also want to thank Congresswoman Woolsey for her impassioned and principled leadership, not only on this issue, but so many issues facing Americans. To loosely paraphrase Judy Collins, we have looked at health insurance reform from both sides now, from insurance companies and consumers, from Wall Street and families, from Republicans and Democrats. But there has been something missing from the debate. This evening, I would like to ask the question, what's a woman worth? Just how important is it to make sure that quality, affordable health care is available to the grandmothers, the mothers, the daughters, and sisters who are responsible for 80% of families' health care decisions, 64% of families' budgets, who represent 79% of the health care providers in this country? What is a woman worth? Is a woman worth as much as a man? One would think so, unless, of course, one was considering our current health care system, a system where women pay higher health care costs than men. Now, believe it or not, in 60% of the most popular health care plans in this country, a 40-year-old woman who has never smoked will pay more for health insurance than a 40-year-old man who has smoked. A lower percentage of working women receive employer-based health care. A system where health situations that affect only women, such as maternity care and mammograms, are less likely to be covered than common male procedures. In fact, 90% of individual policies available to 30-year-old women don't cover maternity care. Now, believe it or not, that is true. 90% of the health insurance policies in this country available to women of 30 years of age don't cover maternity care. Now think about this. This chamber is filled with members who claim to be pro-family and yet defend a system where women have to pay out of pocket to have a baby. Many more women are denied coverage due to pre-existing conditions than men. Why are they denied? They're denied because they are women. If you want the 1 in 3 women in America who have had a C-section, that becomes a pre-existing condition, and you're not going to get health insurance again. If being 1 in 8 of the American women who are diagnosed with breast cancer, that becomes a pre-existing condition, and God help it if you have to go into the individual market and get health insurance, because you just won't. Or even being the 1 in 4 American mothers, daughters, and sisters who are victims of domestic violence. Imagine having been declined health insurance because your spouse or significant other has beaten you and may do it again. And because that significant other or spouse may do it again, you can't get health insurance. As a result of these and other factors, women are more likely to be uninsured or underinsured. And more than half of the women have delayed or skipped needed medical care due to the high cost of treatment. So I ask again, what is a woman worth? Is a woman worth a health care system that encourages preventive care by eliminating co-pays for recommended services such as mammograms and maternity care? Is a woman worth a health care system that bans annual and lifetime caps? Is a woman worth a health care system that prohibits insurers from charging us more than men? Is a woman worth a health care system that covers maternity services, outlaws pre-existing conditions and dropping patients who become ill, and limits out-of-pocket expenses to prevent the 62% of bankruptcies caused by medical bills? I think women are worth that and much, much more. As a matter of fact, women are worth their elected officials showing some backbone to stand up to the multi-million-dollar misinformation campaigns to do what's right and reform a health care system that is unfair, inefficient, and unavailable to far too many American women. I yield back.
The gentlewoman yields back.